Imagine feeding a completely fake identity into a federal portal and walking away with fully paid health insurance.
And doing it over and over again without anyone noticing.
Welcome to today's deep dive. We are looking at the 2026 Affordable Care Act marketplace, and things are shifting fast.
Really fast. We're seeing steep drops in enrollment, skyrocketing premiums,
And massive claims of widespread fraud.
Exactly. It's a completely chaotic moment for the American healthcare system. To help you make sense of it, we've pulled together a huge stack of sources today.
Yeah, we've got independent data from KFF. You probably know them as the Kaiser Family Foundation.
Plus a really crazy undercover report from the Government Accountability Office, the GAO.
We're also looking at proposed rules straight out of the Federal Register and some very recent press releases and interviews from major political figures.
Right, and before we really jump in, we need to give you a quick heads up.
Yes, very important. Today's sources contain some heavily polarized claims. We are talking intense viewpoints from the new administration, policy groups, politicians on both the left and the right.
And our job here is absolutely not to take a side.
Zero sides taken. We're not endorsing any of these left-wing or right-wing political viewpoints. We are just acting as your impartial guides.
Our mission is just to lay out the facts, the raw data, and the specific claims from the source material. That way you know exactly what they're fighting about in Washington right now.
All right, with that out of the way, let's talk numbers, because the whole landscape of who actually has ACA insurance is shrinking. The best place to start is the latest KFF data. The big headline is that ACA signups dropped by about 1.2 million people for the 2026 open enrollment.
Wow.
Yeah. Last year, around this time, we saw 24.2 million signups. This year, it's down to roughly 23 million.
So over 1 million people just dropped out. And the data shows the main reason is the expiration of those enhanced premium tax credits, right? That's the primary driver. During the pandemic, the government basically expanded these tax credits to artificially lower monthly premiums.
It helped a lot of people afford the market.
It did. But those extra subsidies are gone now. And without them, KFF estimates that average premium payments for subsidized folks are going to spike by an average of 114%.
114% increase. I mean, if they stay in the exact same plan.
Exactly. And a price shock like that is huge for any household. But honestly, the situation might be much more volatile than that 1.2 million drop even suggests.
How so?
Well, we have to separate a plan selection from an effectuated enrollment.
Okay, break that down for us.
So that 23 million number, those are just plan selections, people who picked a plan or were auto-renewed. In fact, over 40% of the 2025 signups were automatic renewals.
Oh, I see. So the system just rolls them over into the next year.
Right. But a plan selection doesn't actually become an effectuated enrollment until the person pays their very first premium bill.
Got it. So if a healthy person gets auto-renewed, they open their mail in January, see their bill just went up 114%, they might just toss it.
And not pay it. Exactly. And if all those healthy auto-renewals drop out, the remaining pool of insured people gets much sicker and way more expensive to cover.
So the 1.2 million drop is really just a preview.
Yeah. We won't know the real number of people actually paying for coverage until the mid-year reports come out around July.
Okay, so the market is already stressed by prices, but the actual enrollment system itself, the tech, the security, that's where the sources get really wild.
The vulnerabilities are not just theoretical anymore.
No, they're not. I was reading this December 2025 GAO report, and federal watchdogs ran an actual sting operation on the ACA marketplace.
The way they did it is fascinating. They built 20 totally fake identities to test the system's defenses.
And they didn't just use fake names, they used completely invalid Social Security numbers.
Numbers that the Social Security Administration has never issued to anyone, ever.
And they deliberately claimed income levels that would trigger those advanced premium tax credits. They were basically testing if the portal's automated defenses would catch blatant fraud.
And the defenses completely failed.
100% failure rate on the first try. They submitted fake apps in late 2024, and 4 out of 4 got approved for fully subsidized coverage.
Then they ramped it up for the 2025 plan year with all 20 ghost identities. And by the time the report came out, 18 of those 20 fake applicants got subsidized insurance.
18 out of 20? How does that even happen?
It comes down to a failure in the ACA's data services hub. The hub is supposed to verify your info in real time by checking IRS and Social Security databases.
Right, and if there's a mismatch, it flags it.
It's supposed to flag an inconsistency. That gives the applicant like 90 days to upload proof. But the GAO found the hub just routinely failed. Sometimes they didn't even flag the fake Social Security number.
And when it did ask for proof,
the undercover agents uploaded blank pages. or obviously fake documents, and the system still let the coverage continue.
That is wild. And while the government is doing this to test the system, actual criminals are doing it for cash. Which brings us to the rogue broker problem.
This is a huge crisis right now.
Huge. CMS, the Centers for Medicare and Medicaid Services, they got 275,000 complaints in just 8 months last year.
Between January and August.
Yeah. 275,000 people who suddenly found out their health insurance was switched or a totally new policy was opened in their name without them ever agreeing to it.
It's the weaponization of a system that was actually designed to make things easy. Policymakers wanted seamless access, auto-enrollment, low friction.
But bad actors use that same low friction.
Exactly. Commission-based brokers just need your basic info and their national producer number. They log into the portal, check a box saying you gave consent, switch your plan, collect their commission, and move on.
And the damage to you, the consumer, is immediate. Let's say a broker switches your plan. Suddenly, your deductible resets to zero.
Your out-of-pocket maximum resets.
The doctor you've seen for 10 years is suddenly out of network. Your prescriptions aren't covered.
And the scariest part is the tax hit.
Right. Because if that rogue broker lied about your income to get a bigger subsidy and make the plan look cheap, the IRS is going to come after you at the end of the year to pay back those tax credits.
You think you have insurance, but someone just dismantled your healthcare and left you with a tax bill.
So this systemic failure leads right into what the new administration is doing. They are pointing to these vulnerabilities to justify a massive overhaul.
Dr. Mehmet Oz, the new CMS administrator, is front and center on this.
Very vocal. He recently said having 23 million people on the ACA is, quote, too high of a number.
The administration claims that between 4 and 5 million people were improperly enrolled in 2024, and they estimate that cost taxpayers up to $20 billion.
They're also hitting hard on overlapping coverage. Dr. Oz cited data showing 2.8 million Americans were double enrolled.
Meaning they had Medicaid in 2 different states, or they had state Medicaid and a federal ACA plan at the exact same time. The administration sees this as massive fraud and negligence.
And then there's the PBS interview. Dr. Oz dropped a stat that really caught my attention. He said 12 million ACA enrollees filed 0 medical claims last year.
0 claims.
Yeah.
For 12 million people.
Yeah. He's using that to say, hey, maybe half the people in the ACA don't even know they have insurance. Or maybe they're just broker-generated ghost identities.
But independent policy experts are pushing back on that interpretation really hard.
They are. Richard Frank, an economist at the Brookings Institution, which is nonpartisan, he says the 4 to 5 million fraud number is just implausible.
He thinks most of what the administration calls malicious fraud is actually just administrative lag, bookkeeping errors.
Right, because remember the unwinding of the pandemic Medicaid rules. Millions of people were shuffling between Medicaid and the ACA marketplace.
And sometimes retroactively getting put back on Medicaid if their income changed.
Exactly. It creates a really messy data trail. It might look like someone is double dipping, but it's just a transition period lagging in the system.
And on that 12 million zero claim stat, Cynthia Cox at KFF brings up health literacy.
Which is notoriously low in the U.S.
Very low. Health insurance is confusing. If you get auto-renewed into a plan, you might legitimately not understand how to use it or find a doctor in your network.
Plus, we have to look at the actual plans. If you have a bronze plan with a $9,000 deductible, you are basically uninsured unless you get hit by a bus.
You know you have to pay $9,000 out of pocket before the insurance does anything.
So people just don't go to the doctor. They avoid routine care because they can't afford the upfront cost.
In that light, 0 claims doesn't mean you're a fake identity. It means you're underinsured and rationing your own care.
It's a huge debate over access versus actual utilization. But either way, the administration is moving aggressively.
And they have new laws backing them up.
Right. The One Big Beautiful Bill Act and the Working Families Tax Cut, or WFTC.
These are massive packages. They're changing federal health care funding, tightening eligibility rules that were loosened during COVID, and altering how Medicare and Medicaid work with the ACA.
Under that new umbrella, they launched the CRUSH initiative. Vice President J.D. Vance, RFK Jr., and Dr. Oz announced it at the White House.
CRUSH stands for Comprehensive Regulations to Uncover Suspicious Healthcare.
They are actively pulling financial levers right now. They just deferred $259.5 million in Medicaid funding from Minnesota over fraud concerns.
They also put a nationwide freeze on Medicare enrollment for certain medical equipment suppliers. That's an area that's always had billing abuse issues.
So they are trying to stop the bleeding on the fraud side. But on the policy side, they want to change the risk pool. They're targeting the young invincibles.
Young, healthy people who usually just don't buy insurance.
And the plan to get them is by expanding catastrophic health plans.
Right now, those plans are pretty restricted. Usually you have to be under 30 or have a specific hardship exemption to buy one.
The administration proposed raising or just eliminating those age limits entirely.
We should probably explain how a catastrophic plan actually works financially.
Yeah, the trade-off is rough. The monthly premiums are super low. If you're young and healthy, your monthly bill is nothing. But the deductibles are massive.
According to KFF, the average deductible for a catastrophic plan in 2026 will be $10,600 for an individual.
And $21,200 for a family.
That goes right back to the health literacy issue Cynthia Cox mentioned. The administration says these plans are a crucial safety net.
Right. They say if an independent contractor gets into a horrible car wreck, it stops a $1 million hospital bill from ruining their life.
But critics are worried it will flood the market with people who only look at the low monthly premium.
And then they don't realize they have to pay 20 grand out of pocket before a doctor will look at their kid's ear infection.
For a family making $60,000 a year, a $21,000 deductible basically means you don't have insurance.
It really highlights the tension between affordable monthly bills and actual access to healthcare. But speaking of people not understanding what they are signing up for...
Oh, the Federal Register rules.
Yes. There is a wild detail in these new proposed rules. CMS is proposing a federal ban on brokers using AI-generated deepfakes in their ads.
You know things are bad when the federal government has to officially write down that you can't use fake AI videos to sell insurance.
Please stop using AI Ryan Reynolds to sell a silver-tier HMO. It's the Wild West.
It really shows how fast AI is moving past federal regulations. The rule bans brokers from using any fabricated image, voice clone, or likeness of a celebrity or politician.
Because brokers use these deepfakes on social media. You click the fake celebrity endorsement, they capture your data, and boom, they run that unauthorized plan switch we talked about.
The fact that CMS has to explicitly ban this shows how sophisticated the scams have gotten.
We have covered so much ground today. The dropping enrollment numbers, the 114% premium spikes, the GAO undercover sting with the ghost identities.
The massive debate over those 12 million zero-claim enrollees.
Exactly. So what does this actually mean for you listening? Why should you care about all this ACA policy stuff?
Well, the biggest takeaway is that these vulnerabilities affect the whole system. Even if you get insurance through your job and never touch the ACA marketplace.
Your tax dollars are still funding this.
Exactly. The efficiency of federal healthcare spending changes the overall cost of the national healthcare infrastructure. And that impacts the premiums and deductibles for everybody.
Plus, your personal data is at risk. Rogue brokers are easily manipulating the system. The GAO proved that fake identities can bypass the federal verification hub.
Your Social Security number could be caught up in this bureaucratic machinery without you ever knowing.
It's all deeply connected and, frankly, deeply vulnerable. Which leaves us with a final thought for you to chew on.
What's that?
We just talked about brokers using AI deepfakes to steal data. We talked about fake identities sliding right past the government's defenses.
Right.
As digital fraud gets more and more advanced, will the future of your healthcare access depend more on cybersecurity and AI defense systems than it does on actual medical policy?
That is a very real question. The line between healthcare policy and data security is basically gone at this point.
It really is something to keep an eye on as things continue to shift. Thanks for joining us for this deep dive into the sources. We'll catch you next time.